This is the 20th year of the Future Health Summit, and it's still a privilege to be able to bring together thought leaders to discuss the major challenges that are affecting the health systems both here and internationally.
The summit really is a superb platform for people throughout the health service to get together and connect with people who are important to them.
I think in terms of just having one collaborative summit, I think this is the premier one.
Innovation that's been showcased has been amazing, and the amount of it that's Irish innovation has been really impressive.
Absolutely, the speakers have been fantastic so far. It's been a wealth of information that's been shared. In fact, I just talked to Mr. Watt and told him I'm going to take some of the things that he talked about this morning and transfer them back to my team in the United States.
It's a very important event for us, and Investnet really gather a really high calibre of people in the same room, and it's certainly a significant annual event for us.
It gives us a great opportunity from the point of view of our future health, and this is the Future Health Summit, our future health and what changes that we need to see from our supply base and our supply chain, the challenges that are there, exchanging mutual challenges from the point and how we're going to overcome them.
The design around healthcare provision changes and the introduction of the RHAs, it brings the acute and the community sectors together, so this is a great forum for all of us to meet.
An amazing opportunity. It's exactly the right size of conference where you can actually get talking to people during the coffee breaks, and at the same time the sessions have been interesting and very broad. So not only have we learnt about specific things that are related to the work that we do, but also the broader, more international healthcare trends that I suppose I maybe wouldn't have been that aware of. I feel like I've really been able to take a lot from it.
So really here to learn about different ways of doing things and to share knowledge about how digital technology and digital transformation can be used to radically change the way that we deliver care for patients, both within our own hospital systems and more broadly.
The calibre of the speakers this year has been impressive, but particularly notable has been the calibre of the delegates and the amount of networking that's been going on, the opportunity for people to connect and share ideas has been really a joy to watch this year actually.
The variety of content has been brilliant, and what really surprised my colleagues and I was the sheer volume, the number of people who are involved in healthcare in Ireland. And I think it was Robert Watt who commented that the healthcare sector is the biggest employer in the country.
The audience was a mix of industry, pharma, healthcare providers, healthcare planners and frontline operatives. And that's really, really important because that gives a unified approach, and the sharing of that sort of level of experience you don't find elsewhere.
By bringing together various leaders here at the Future Health Summit, we're hopefully going to reach out to the leaders of the future and hopefully make a positive impact for the Irish healthcare system.
Certainly helps to understand what's out there, to make connections, to talk to people, to network, so it's a great opportunity for that.
For BlackRock Health, Future Health Summit is a sentinel event that takes place using a clinical term on an annual basis, but a positive sentinel event. It allows us all, as I said, to gather thoughts, look at different ideas, and BlackRock Health is all about innovation, driving forward the healthcare proposition to the Irish population into the future, so it's core to us as an event.
And I see it as the vehicle in our industry, in health industry, to meet like-minded people, and I see it as a huge opportunity to meet existing and future partners.
Attending an event like this, and hopefully the visibility that this award will give us, will allow us to engage with more hospitals in this ecosystem, which is really, really important. I think up until this point, most of our engagements have come on the public hospitals through the HSE, and now because of the attendance of the broader ecosystem, our hopes is that we can expand that reach and start to work with them also.
Winning these awards is actually important as a marker that somebody else has looked at you, believed in what you're trying to do, and what better audience than the Future Health audience.